So I am interested to know how many of you know somebody with diabetes? Wow, that's a lot of people. That is a lot of people. The estimates are that by the time we get to 2030, 1 out of every 4 people will have diabetes or pre-diabetes. 1 out of every 3 African American or Asian, Hispanic, not Asian, Hispanic individual or Native individual, First Nations for you, will have diabetes or pre-diabetes. So that's an epidemic. That's just absolutely crazy. And a lot of people are saying, well, my father had diabetes, my mother had diabetes, my grandfather, all my uncles have diabetes. Is there any way that I can avoid diabetes? I say, oh, absolutely. There is a way to defeat diabetes. But before we do that, I want to pause for a moment and ask for help from the one who has never lost a case, who has reversed all diabetes, and will someday reverse those who remain in this world. And that is the good Lord. Please bow your heads one more time with me. Loving Father in heaven, you are the great physician. And I want to acknowledge you as the great leader of not only my medical practice, but all of ours, Lord. And I just pray that you would give me grace and strength and clarity of thought and of word to bring blessing and healing not only those who are here, but those who are online and their loved ones. May I be hid behind the shadow of your cross, we ask in Jesus' name, amen. If you can imagine, thanks babe. If you can imagine the announcement on the plane as you're traveling, will any health professional please ring their call light? How many of you have heard that announcement before? How many of you have answered the call? It was very interesting, but I've kept a running total of these incidents, and that announcement is made approximately 1 out of every 4 trips for me. It's very frequent. People say, that's odd. Yeah, even on our honeymoon, it happened. And I have answered every call. And a lot of people will say, wow, that's pretty crazy. And I said, well, no, you've got to answer the call because you are. And I was crossing the ocean to do TYC, Taiwan Youth for Christ. I was going to be some TV recording for them and do their camp meeting when I had that announcement made. But I looked over at me and I saw a young woman seizing in the aisle kind of on the other side of the plane. So I knew what they needed. So I immediately got up, went over there, and the stewardess is kind of just hanging on to her. This lady's in her 30s and she's vomiting. So I immediately put her on her side. So instead of aspirating, she'll at least vomit on the floor on me as well. And I asked her, I said, do you have a kit? She says, yes, we do. And she starts leaving. I'm like, no, send someone to get the kit. I still need you here. And I think they brought a medication kit, and I said, I need an IV kit as well. And they brought me one of those, thankfully. Another guy shows up, another physician. He says, what specialty are you? I said, I'm emergency medicine. I'm going to sit down. I said, wait. Stay. He's like, I'm an orthopedic surgeon. I haven't taken a blood pressure since medical school. If she dislocates her shoulder during the seizure, call me back. I'll put it back in for you. And I said, no, I need you to go through her stuff. He's like, that's her stuff. I said, that doesn't matter. She's seizing. So he went through her stuff. I'm trying to put in the IV, whatever. And he finds a glucometer. So what do you think I'm thinking is the cause of the seizure? Which sugar, which direction? Hypo, right? So I'm thinking it's hypo. He takes her sugar and it's 6.3. The Spirit tells me, don't believe it.
You have to translate it to
I did translate into Canadian terms. Did you like that? Canada, eh? Yeah, 144, 150 in US units if you want. So I did an exam on her, and I felt a lump in her abdomen, a hard lump. And I said, perfect. So I reached into her pocket, and I grabbed her little meter because she had an implantable pump. And it showed that her sugar was 0.3. 8 in US units. Any of you seen a single digit sugar? Any of you seen a single digit sugar ever? Health professional? No, none. One. What was your sugar? Yeah. No, a single digit sugar in US units. Yeah, and your unit's like 0.28, 0.3. Yeah, it doesn't exist, does it? So I literally had the nurse holding down her arm while I start the IV. And who usually starts the IV? It's the nurse. I mean, I don't start peripheral IVs. Give me a central line. I'll help you out with that. No problem. But I looked up to heaven and I said, Lord Jesus, help me to get the IV on the first try. And I said it out loud. I didn't care. And I got a 20 into her AC the first shot. I was like, wow, I was surprised. It was the Lord. And I was like, listen, what do the nurses do? Okay, get the air out of it, kind of like get the whatever, get the fluids going. So I'm running fluids. And I push the D50. And as I'm pushing it, she just goes, she opens her eyes and looks at me. And I push another, and she starts talking. And then, of course, I tried to feed her right away with whatever they had, like juice or whatnot. And then she started walking around. I said, well, no, just stay in the seat. Just stay in the seat. Because the problem is before the sugar, I looked at the kit, and there's no benzodiazepine. So if this was a seizure from any other cause, I'm like, she's dead. You know? And this was before the orthopedic surgeon got back. And he said, do we need to ground the plane? I said, yeah, this woman's in trouble. There's no benzo here. And he said, our nearest port is Taiwan. We're over the ocean for 3 more hours. And I'm just like, wow. So we'll come back to Our Lady in a moment. But let's talk about diabetes. What types of diabetes are you familiar with? Type 1 and type 2. Have you heard of adult onset, juvenile onset? They no longer use those terms. Gestational, what else? That's what most people know. There's diabetes insipidus, there's bronze diabetes, there's many other forms of diabetes beyond the scope of this lecture. So the main three I'll probably talk about are gestational, type 1, and type 2. And what is most common? What's the most common form of diabetes? Type 2, of course, which is what most people would call adult onset. However, that's a misnomer now. I was in the ER. I thought, easy patient, ear pain, 6-year-old ear pain. Oh, very easy, right? I walk into the room, the nurse walking out, I said, I want a D-stick. She's like, on the 6-year-old? I said, yes. And the reason why I wanted it is the 6-year-old weighed 180 pounds. Yes, about 83 kilos, roughly. To give you an idea, I'm 6'1" or about 187 centimeters, and I weigh about 210 pounds. So she weighed close to what I weigh at 6. Her blood sugar was already 11.1. And at a random sugar, that's diabetes until you prove that it's not. If it's that high at a random check, it's diabetes until you prove that it's not. Now, the cutoff that most people have heard of is 7, right? If your fasting blood sugar is greater than 7, then that's when you need to get like a glucose tolerance test, hemoglobin A1C, all these other things. You probably should get the hemoglobin A1C just as part of screening labs before. But now you'll notice that the high value is for any sugar greater than 5.5. Have you noticed that on your blood work? 100, for those of you who are from the United States, like Marlene. So have you noticed that it's always flagging high if it's above 5.5? Do you know why they do that now? Prediabetes, correct. So if they've shown that if your fasting glucose is consistently 5 or above, you have the gene for diabetes. If it's 5.3 or above, you have both genes on both sides, from mom and dad, for type 2 diabetes. So we don't use adult onset anymore. We use type 1, which is what used to be juvenile, right? And type 2, which used to be adult onset. Type 2 is insulin resistance. Type 1 is an immune reaction, they believe, that kills the insulin-producing cells, the beta cells of the islets of Langerhans, if you want the formal medical term of that. But there's many other forms, and let's talk about gestational diabetes. Is it like type 2, like type 1? It's like type 2. Now, why is that a big deal? Ha ha ha. Why is it a big deal to have gestational diabetes? Yeah. Yeah, likely be what? Yeah, the baby's going to be big, right? Because the woman is insulin resistant, but the baby is not, right? So in an attempt to get rid of the glucose, the mother's circulation is going to release more insulin into the bloodstream, and who's going to see that? The baby, right? So the baby will start to grow inappropriately large. And I've seen babies 7, 8, 9, 10 kilos. Huge. Yes, that happens. When things aren't regulated, there's no care, a lot of things happen. A lot of things go wrong. It's crazy. I mean, those are C-sections, obviously, right? So it's a big deal. Does anyone know what people group, what race has the highest incidence of diabetes? That's correct. It's the First Nations, the natives. Do you know what tribe? Eskimos are very high. The Pima actually are number one. The Pima. So natives have the highest incidence of diabetes, and a lot of people have expostulated as to why that is, because a lot of the native physiology is sort of a hunter-gatherer physiology, and they're waiting for the famine, but the famine never comes. That's the problem, right? That's the issue with our first world nations. Well, first world peoples in a first world nation, right? Symptoms of diabetes. Anyone know what the symptoms of diabetes are? Well, thirst is more type 1 diabetes, right? Thirst is more, but it can be if your sugar's very high, even if you're type 2 diabetic. Weight loss is more type 1. Shaking, that's pretty general. Yeah. Frequent urination is more type 1, but anything a predictor for type 2 diabetes. Obesity is definitely correlated. Sign, symptom, anything else? Blurry vision. If you have high blood sugar, definitely you can. Does anyone know why that is? So, any chemistry buffs here? Anyone like chemistry in school? Nobody liked chemistry in school. That's too bad. I'm glad my wife did. So, if you look at your eyeball, the lens is fluid filled. And you learn in chemistry that water follows solutes, right? So when the sugar is high, what's going to go into the lens? Water, right? Because the sugar's everywhere. And when the lens swells, it is no longer flexible, right? And that's how you accommodate. You can see far away because the corti relax, and when you want to see close, they snap tight and kind of flatten the lens a little bit and allow you to see close, right? So that's how it works. One of my professors said that if you understand the physiology of the body, you never have to memorize anything. Believe me, we still had to memorize a whole lot of stuff in med school. But yes, understanding how the body works helps it to be less. It helps it to be less. But yes, blurry vision is definitely one. Does anyone know what acanthosis nigrans is? That's a big mouthful. Does anyone know what that is? I know you want to answer, Ashley. That's all she did was diabetes, pretty much. That's her entire training before she sat for her board. By the way, my wife is a full ride scholar to ASU for 7 years. They paid for all her schooling. Plus, she was one of only 2 of them selected for a scholarship for internship. Plus, she sat for her boards and got the highest score that she or any of her friends have ever heard of. So very proud of her, yes. Very proud of her. She's super smart, but the most amazing thing is she never kind of tries to lord it over me or compete with me or anything like that. She's very feminine, very respectful, and I love her with all my heart. So, acanthosis nigrans is kind of this hyperpigmentation of the armpits. And that is a beacon of warning that there is underlying type 2 diabetes. A lot of people will say they get frequent infections, right? Numbness and tingling in their feet or their fingers, right? So those are common signs and symptoms. But the problem is that you may have no signs or symptoms. That is very important to understand because people need to see their doctor and get screened, get checked up. In labs, we talked about 7 being kind of the cutoff, but also the flagged as high. What we're finding now is that 90% of type 2 diabetics already had kidney damage by the time they were first evaluated. So a lot of these issues are unfortunately creating permanent damage in individuals because they haven't been seen soon enough. And why does it matter to diagnose someone with diabetes? Well, what's the number one cause of death in diabetics? Does anyone know? Heart attack. What's the number one cause of death in Canada? What's the number one cause of death in the United States? What's the number one cause of death worldwide? Heart disease, right? Norway. Does anyone know what the number one cause of death in Norway is? It's cancer. Yeah, but I shared that. You were here. Yeah. That's just kind of a little one to trip you up. Number 2 cause of death, generally, worldwide? Cancer. Number 3 cause? No, COVID. It is. It's COVID. I'm just saying. It is. It's number 3 cause of death is COVID. So it's very important to diagnose that because there's not just an increased risk of death, but there's an increased risk of complications for diabetics. Diabetes is the number one cause of other things that don't necessarily kill you, but they can make life very hard on you. Diabetes is number one cause of dialysis. Some people will say it's hypertension, actually. That kind of goes back and forth. But is it fun to be on dialysis? No, not at all. Even if it's peritoneal dialysis, you can do it at home. I mean, if you're put on dialysis, you literally have the next 1 to 3 years, you will most likely die. It's very serious. So, and it's also a decrease in quality of life, having to go someplace 3 times a week, sit there, right? So renal failure, number one cause of what else? Pancreatitis, it's not. That's interesting. The number one cause of pancreatitis is alcohol, followed by gallstones. But interesting. Also drugs, big cause of pancreatitis. But not diabetes. Some of the drugs can cause diabetes, pancreatitis from diabetes. But what else? Number one cause of? Heart disease, not really a cause. It's one of the 4 big risk factors. Can anyone name all 7 from before? Raise your hand. I want to see if you can name all 7 risk factors. You think you can? Go for it. Give me the top 7. This is from the AHA website.
Heart disease.
No. Heart disease. What are the top 7 risk factors for heart disease? For heart disease. High blood pressure. What else? High cholesterol, yes. Smoking, yes. Diabetes, yes. Now, the 3 most recent ones. That is a risk factor for death, but not specifically heart disease. That's number 7. Lack of sleep is number 7. That's the most recent one they added. The other 2 are sedentary lifestyle and obesity. But sleep, poor sleep, is a recognized risk factor for heart disease, one of the big 7 now, so keep that in mind. So number one cause of renal failure, number one cause of, well, what happens when people get complicated diabetes? What do you see on them happen?
They have amputation.
Amputation, sure. So peripheral vascular disease, definitely. Peripheral vascular disease, amputation, blindness. Yes, why do diabetics get blindness? Diabetic retinopathy, right? So it basically creates these stringy sort of blood vessels in the back of their eye, and those tend to be very fragile, and they bleed. And if you can get to them sooner, right, the ophthalmologist can take care of those vessels so they don't burst and bleed and blind that person, because you can't see through a clot. You can't see through a scar. That's the problem. So number one cause of blindness. Some people say actually macular degeneration is the number one cause of blindness, but I tend to agree it's probably diabetes. And one more thing. Number one cause of, I'll give you a hint. When I was in med school, there was a blood pressure medication that really wasn't doing so well. So they kind of scrapped it and they were going to take it back to formula and whatever. And so they went to these individuals and they recalled all the drugs of the people in the trials. And they would call people, try to get a hold of them, and they couldn't get a hold of people. People kept ghosting them. Finally, they went to their houses. And they're like, would you tell us, can we get the drug back? It's not working. They're like, yeah, it's not so great for my blood pressure. It's all over the map. But I really like one of the side effects of the drug. So they took the drug out of the cardiology department into a different department, and everyone in that department sold their homes, cashed out their 401k, all their retirement got cashed out. They maxed out as many loans as they could, both attendings and residents, and they put every single dollar they had into Pfizer. Does anyone know what that blood pressure medicine was? Viagra. It's true. I'm telling you the truth. I was there. I was there when it happened. I thought people had lost their minds. But in 1 month, they had 700% profit on their investment. Now that's the classic insider trading, isn't it? Because they were doing the trials on these patients. And they're like, this is going to be big. I can't tell you what it is, but it's going to be big. So that is the number one cause of erectile dysfunction, diabetes, right? So it may not kill you, but is this a quality of life issue? Absolutely it is, for sure. So let's think about the everyday person who's not diabetic. To give you an idea, when you eat a banana split, something like that, heavy fat load, right? You become a transient diabetic for about 2 hours till your body can bring that sugar down. Have you ever noticed that you get the cold or the flu after you've had that big, thing you shouldn't have eaten, basically? Right? Man, don't give me that sugary ice cream because I don't know, I think I'm gonna get a cold, right? That's because it suppresses your immune system. A white blood cell in an uncontrolled diabetic can only kill about 1 to 2 bacteria, whereas if it has normal blood sugars, it can kill 12. So it's much more effective at protecting you in terms of disease, infectious illness, things like that. Let's take a look at this. What if you're perfect in controlling your diabetes? How long will you live if you're a perfectly controlled diabetic? How long will you live? You'll lose 10 years. Even if you're a perfectly controlled diabetic, straight across the board. So if you're Adventist, you pretty much lose your entire Adventist card. You might have just turned it in, So no, just kidding. Don't turn it in, please. But you lose all but 1 year because we get 11 extra years than the average individual. So if you're diabetic and you're perfect at controlling it, you lose 10 years on average off your life as if you didn't have diabetes. Now, I'm going to go ahead and go into the cause of diabetes because Ministry of Healing, page 127, says in the case of illness, the cause should be ascertained. Very important. And the cause of diabetes is? Who said fat? I am so proud of you. Wow. President Brad, your congregation knows what they're talking about. That's fantastic. That's good. Has Jonathan been here and maybe given some lectures? All right, no, not yet. Hopefully some camp meeting, right? Have him pay for the ticket, free visit home, right? There you go. That's what I'm talking about. Tell him I'll put him in first class if he's on United. So anyway, the cause of diabetes is fat. That's correct. And Dr. James Anderson, in a classic study, this study is from before I was born, basically. And he did a study where he took healthy volunteer men and he fed them almost 1/2 kilo of white refined sugar every day. Isn't that wild? I mean, how could you even do that? And it's very easy. Did you know in the average, just 300 ml can of pop, there's already 12 teaspoons of sugar in that? That's crazy. That's just on average. And just imagine how many teaspoons of sugar people put in their coffee every morning. Craziness, right? You'd be surprised on how easy it is to get that much. And he measured their urine glucose, he measured their serum glucose, he did glucose tolerance tests, he did hemoglobin A1Cs on them. None of them showed any evidence after doing this for 14 days straight. And then he kept going for another 14 days. He could not induce diabetes in it for a month of eating a 1/2 pound of refined sugar. He did the same individuals, and that's what's called a crossover study. So they served as their own controls. He put them on a 60% fat diet. In 2 weeks, all of them had signs of diabetes. Urine, blood, glucose tolerance, hemoglobin A1Cs. Started creeping up. So the cause of diabetes is fat, not just in the diet, but on you, especially here, the apple obesity, right? They've looked at different shapes of obesity, and this specifically for women. You've heard of apple, the pear, the banana, the hourglass, right? You've heard of those different shapes. They've actually looked at those shapes for heart disease for women. Did you know that? Do you know what the worst shape is for any of us, not just women? What is it? Not pear. Apple is worse. Does anyone know the best shape for a woman is protective for heart disease? Hourglass was actually lowest incidence of heart disease. That's correct. So does it matter where your fat distributes? Absolutely it does. Absolutely it does. Very, very important, because that is telling you what hormones are coming into play where the fat is deposited. And if it's here around your midsection, that is, as we say in Spanish, no bueno. Not very good. Not very good at all. So let's take a look at the common treatments for diabetes. What do they typically use as far as hormone for diabetes? Insulin. Now that's not the first treatment they use, but I just want to talk about insulin for a second. Insulin is what kind of hormone? Do you remember from gestational diabetes? What does it cause you to do? Grow. That's right. And the problem is that maybe your doctor puts you on some insulin, he takes you to the dietitian, he takes you to the physical therapist, they teach you how to exercise, eat right, whatever, and then they tell you to see them in a month, and you follow up and you've gained 2 kilos. And I don't understand. I'm following everything. Okay, well, let's increase your insulin, do this, we'll see you in 4 weeks or something like that, and then you've gained another 1.5 kilos. And they're like, I don't understand what's going on. I mean, I just gain weight from smelling food now. And why do you think that person's gaining the weight? Because they're on a growth hormone. Did you realize that? Yes. Now, I'm not saying insulin's evil. I mean, I use insulin all the time, but in my line of duty, I'm seeing people in diabetic comas. I'm putting them not just on insulin, but on insulin IV, on insulin drips. I'm giving them fluid boluses, I'm monitoring their electrolytes, intubating them, putting them in the ICU, and people like Dr. Thorpe, their son, are taking care of them. So insulin, though, we must remember, is a growth hormone. And one of the things that actually accelerates atherosclerosis more than anything else is insulin. And why would that be relevant to the diabetic? What's the number one cause of death? Right? And if you accelerate atherosclerosis, that's going to narrow their coronary arteries even further. Have you ever heard someone say, hey, my doctor upped my insulin and now my diabetes is cured. I don't have to take any more meds anymore. What's the traditional cure rate? 0, right? It's just like, oh wow, I just bought these glasses and now I'm not nearsighted anymore. Am I not nearsighted anymore? As long as I've got the glasses. That's the same thing with the diabetic. As long as they're on the insulin or the meds or whatever, their glucose is controlled. Because I'll ask patients, I say, do you have high cholesterol? No. I said, but what are you on Lipitor for? Oh, that's for my cholesterol. And I'm like, then you have high cholesterol. Do you have high blood pressure? No. Well, why are you on losartan? My blood pressure is normal now. So people view the medications we give them as eliminating the risk factor, and that is not true. It's just managing the risk factor. And that's important. You need to manage the risk factor. You don't want your blood sugar out of control. You don't want a cholesterol out of control or blood sugar out of control or stuff like that. But it doesn't mean you don't have the risk factor. But here is another thought. Does anyone know what a sulfonylurea is? Glipizide, glyburide, have you heard of those medications? Those are common medications used for diabetics. What they do is they stimulate the pancreas to release more insulin. Yes. But did you know they also have a black box warning on them? Do you know what black box is? It means death. That's right. Sulfonylureas have an increased risk for fatal heart attack. Now remind me again what the number one cause of death for diabetics is. I'm just saying. And again, I prescribe medications pretty much every day that I'm at work. But these are managing symptoms. The most commonly prescribed drug for diabetics is what? It begins with an M. Metformin. Sure. Does metformin have any problems? Have you ever had a CT scan with contrast and it asks, are you on metformin? Do you know why we ask that? The reason why is the body's detox system in the kidneys has to clear the metformin, and the contrast is cleared under the same pathway. And if you don't stop the metformin, you'll basically hurt your kidneys. What it's trying to deal with both the contrast and the metformin at the same time. Any other issues with metformin? Lactic acidosis, very rare, but you can get it. Also, your doctor's going to check your liver enzymes before he or she puts you on it. Did you know that? Because metformin can hurt your liver. So they actually check before and after you've been on it for a while. They'll make sure that it's not harming your liver. They'll watch for a bump in your liver function test, and if there's a bump, they take you off of it right away. So that's something important to keep in mind. I'm going to introduce you to a better way. Because yes, in the acute phase, I think all these drugs have a role and they should be used. However, in the long term, you will not cure that patient's diabetes. Now let's go to the oldest controlled trial known to man. It was done on the plain of Dura at the University of Babylon. The control group was the captives of Judah. The experimental group was Daniel, Hananiah, Mishael, and Azariah. And the trial was 10 days. And the trial consisted of this. This is a dedicated statement to Danny Vieira, one of my other mentors. It was either the regular, standard, kingly fare. Well, was that poor quality food? No, the king would not give them poor quality food. He would give them the caviar, the escargot. Right? He would give them the creme de la creme, the best quality. Farm fed. grass-fed, free range, organic, whatever you want to say, right? He would give them the good stuff. In the experimental group, in dedication to Danny Vera, give me pulse, Melzar. And what was pulse? Vegetables, fruits, beans, nuts, right? Whole grains. And what did they drink? Water. Now I find this very intriguing because in just 10 days, will there really be a difference in 10 days? Can people have results in their health in just 10 days? At the end of 10 days, their appearance was fairer and healthier than how many children? All the children which should eat the portion of the king's food and his wine. Now, what did Daniel and his friends drink? Water. Now, after 3 years, was there a noticeable difference? After 3 years, the king found them how many times better? 10 times. There's not even a comparison at that point. So he took them and put them in the court, like right near him, so he could have them as his immediate advisors. He found them 10 times better than all the wise men in his realm. Now, here's a very honest question. This is not meant to be funny. But why didn't Daniel say, give me kosher, Melzar? What religion was Daniel? He's Jewish, right? Could he not have said, give me kosher? Could he say, give me lacto-ovo, Melzar? I'm just saying, he could have said that. Could he not have said that? Give me pescatarian. I'm just saying, right? Why did he have to be extreme? Where did he get that idea? That probably was not how he was raised, honestly, but possibly. Where did he get that idea? They knew what the original intent of God for mankind was. And they knew they did not have forever to make their claim with this guy. Melzar wasn't going to wait around forever because he was already afraid of what? His head, right? Between the king. He says, if you are not looking good, the king will take it out of my hide, right? He was not going to wait around forever. And they knew that in the Pentateuch, that the original diet for man was the products of the earth. He could have said, feed us soda pop, give us milk, give us juice. Could he not have said that too? That's another point. Water, right? Water. Not to say it's evil to drink those other things, occasionally, but between meals you should be drinking water, right? Very interesting. I love the verse you guys use in your health video. Betty, your team made that video. John 5:6 is really the only question to be asked. Do you want to get well? And my chef who served my grandmother lived with me for about 15 years. She lived in my home in Seattle for a long time. Unfortunately, she had a stroke the last 8 years, so she had to have caregivers. So this was my chef. I had a chef who made all her meals. He was diabetic. He poked his finger. He's getting ready to cover himself on his sliding scale. And I said, hey, what are you going to do? He's like, well, I'm taking my medicine. I said, why? He's like, my sugar's like almost 300. And I said, just hold off. He's like, you doctor, tell me not to take my medicine. I said, no. I didn't say don't take it. Just wait. Wait for what? I said, take this liter of water, take grandma, take the wheelchair, push her up and down in the park, in the hilly park nearby, drink the liter of water, then come back. He's like, well, who's going to make her lunch? I said, I'll make her lunch this time. Take your time. He's like, okay. So he goes out, pushes grandma up and down the hills for an hour, drinks the liter of water, and he comes back and he checks his sugar. And what do you think has happened? It's gone down. Now, it wasn't normal. He still had to cover himself with a couple units, I think, of insulin. But I said, every time you go to do your sliding scale, I want you to take my grandmother. I give you authority. I'm still paying you for the time. Push her around for an hour. Take her outside. take the liter of water. Because what's the water doing? Again, he's going to dump sugar, right? In 5 months, he lost 25 pounds. He got off all his insulin, all his metformin, all his glyburide. And his doctor said to him, "What are you doing?" He's like, "Oh, I just walk and I drink water." And she's like, "And?" "That's all I do." "What do you eat?" "I just eat with the doctor." "Who's this?" "Oh, I take care of grandma, eat her food." "What do they eat?" "We ate plant-based." Now, grandma, I will confess, she did like some smoked salmon. I'll give a confession. However, my friend worked in the Alaskan fisheries. He came to Seattle, but he would meet his friends at the dock in Alaska, get the fillets fresh. He had his own brine and his own smoker. He would create a cedar organic plank, put a fillet for my grandmother. She'd get 1 fillet a week. So she was plant-based plus the fillet of salmon. She needed the protein and the calories, honestly. But anyway, so he told his doctor this, and she's just like, "What? You just walk around with a pitcher of water?" But what he should have told her is that when his sugar is high, he would intervene, because that's the way you evaluate. When he evaluated something was wrong, he did vigorous exercise. He's pushing my grandmother up and down these hills. Plus, he's drinking a liter of water, right? Within 5 months, his diabetes was gone. Unfortunately, my grandmother passed away right before COVID. Sorry to say. And he left our home, and all of it came back. Yes, I'm sorry to have to say that. Because he was no longer eating, exercising, drinking. I did this for our chef because I knew he needed something extremely simple. I tell my coaching students, and I say, don't give someone ever more than 3 things. I gave him pretty much just 1 thing. When your sugar's high, go take a walk and bring your water bottle. That's it. And then recheck your sugar when you get back. Interesting study that was a head-to-head study with the American diabetic diet and the vegan plant-based diet. This was a 22-week study that looked at outpatient results, which is very important because I tell people this. They say, "What's your favorite food?" "The food that you're cooking for me. That's my favorite food because I don't want to cook for myself. I love my wife's cooking. You do a great job, babe. But I'll eat any cooking pretty much that's healthy and someone else is preparing." But this was an outpatient study. They had to provide for their own meals. It was not provided. At the end of 22 weeks, they found that almost half of the plant-based group was able to reduce medication as about a quarter of the ADA. The plant-based group lost 14 pounds, which is roughly 6.5 kilos, versus about 6 pounds, which is more like 2.5 kilos for the ADA group. Now, this is what's really exciting to me. The LDL cholesterol, what's that, good or bad? Bad. The LDL cholesterol dropped 21% in the plant group. Now, why am I excited about that for a diabetic? Because their number 1 risk of death is heart attack, and the LDL is what's going to block their arteries, right? So, just to give you an idea, a 21% reduction in LDL is reducing your risk of heart attack by 63%. That's a huge reduction. They also had better glycemic control in the vegan group. Does anyone know who the Physicians Committee on Responsible Medicine is? PCRM? Did you know that their researcher is Seventh-day Adventist? Yes, she is. She did a study on 3 meals a day versus 2 meals a day for diabetics. Because what do they usually recommend for people? Small, frequent meals. That's the diabetic recommendation. That's the IBS recommendation. That's the everything recommendation. It's true. Whenever I get my diabetic or dietetic input, it's always give this patient small, frequent meals. It's true. But she looked at 3 meals a day versus 2 meals a day for diabetics. And do you know what won out? 2 meals a day. Nobody would think that, but it did. What's interesting is they always try to control people's carbs, but the vegan group actually increased their carbs. Do you know what I tell people who are uncontrolled diabetics? One of my friends, his blood sugar was 21. Just crazy. Like just walking around with sugars 450, 480, like in the American units. And he had gone through the 3rd round of antibiotics for cellulitis on his legs. And I looked at his legs and I said, you're forming an abscess in at least one of them. He's like, well, what does that mean? I said, you're gonna have to have it cut open. He's like, oh, I don't want surgery. And I said, you're gonna have to go see, I don't wanna see a doctor. I won't see a doctor. And I'm like, but you're talking to me. He goes, oh, but you're my friend. And I'm like, okay. Do you like fruit? He said, yes. What's your favorite fruit? He's like, I like apples. I said, buy 30 organic apples. He's like, okay, great. And just eat apples. He's like, what? 4 apples for breakfast, 4 apples for lunch, 2 for supper, water in between. And the average person will say, well, that's pure carbohydrates, doc. You're going to kill me. But am I going to kill him? No. He finished the weekend and his sugar was down to roughly 10.9. Still high, like 200, 250, right? But he saw the power of a raw produce diet. I do the 10 apples a day because it's 1,000 calories. Each apple's 100 calories, very easy, right? Because no one can accuse me of, oh, you're starving the patient or whatever, right? So carbs is not the cause of diabetes. What is it? Fat. So in the diet or in you. Let's get back to the woman with diabetes, okay? When we landed the plane, the paramedics met us at the gate. And she says, what is all this for? I said, I told you about this. You need to have your pump interrogated. She says, oh, I have low blood sugar all the time. And I said, when was the last time you had a seizure and your blood sugar was 8? Or in your units, 0.3? Never. And I said, listen, you may board the next flight and you may die. And she says, would you butt out? I'm dead serious. She looked at me in the eyes and said that. I turned to the gate edge. I turned to the lady. I said, you're not going to like this. I said, I don't recommend that this patient board the next flight till she's formally cleared in the ER in Taipei. And the agent looked at me and said, done. And the woman says, you can't do that. I said, I just did. And she stormed off, furious. But I went to sleep that night, and my pillow gave me complete tranquility. Because I saved that child's life, that child of God. She's in her 30s, young, but also smoker. And type 1 diabetic. Type 1 diabetic. And the agents were very nice. They treated me and the orthopedic surgeon to the lounge, and also they upgraded us to business on our next flight. They were very grateful for what we did. But she was not happy. But I want you to know that the problem with diabetes is that the cell is resistant to insulin because it's overfull with fat. And the answer to it is not to force more insulin into the cell, but to burn the fat. And that is the answer to life. Do you realize that? It's not to hoard everything, but it's to give. It's to burn the calories on behalf of others. And that's how the cell becomes less insulin resistant. When my chef pushed my grandmother around, he not only was using insulin and sugar, but he was burning fat. And so his cells became less and less resistant to insulin over time until he didn't need it anymore. His body's own natural insulin would be enough to let the glucose into the cell. And that is what we need. What age of the church are all of us? We're not Philadelphia. I wish we were. We are Laodicea. And the problem with Laodicea is I am rich and increased with goods and am insulin resistant. Resistant to the message of the 3 angels and the faithful witness. Increased with goods and have need of nothing. But we don't know that we are wretched, miserable, poor, blind, and naked. We're increased with goods. We have everything that we could need. But when we're over full, we're resistant to insulin. We're resistant to God's message. And the answer is very clear, is to give, to take action, to help others, right? I'm going to give you just a real quick 3 secrets to weight loss that your doctor may not be telling you, okay? How many of you enjoyed the green salads we had every meal? That's great for lunch, fantastic. How many enjoy the fresh fruit we get at breakfast? Good. So what I would like you to do is before every meal, just eat an apple before every meal. That's all. End of story. Now you can do apple. Yes, apple. I love it. Happy Sabbath. Remember that? I just learned that today. So eat an apple before anything else. Or eat a salad with just lemon juice on it before everything else. Because it's not the salad that's going to do you in, it's what you pour on the salad. And it's like some people, I look at it, I'm like, would you like some greens with your ranch dressing? I mean, that's like crazy. So give yourself the appetizer for every meal. And the reason why I choose an apple is there's nothing magical about the apple. It's not really what you're eating, but it's what you're not eating. Because the apple's going to fill you up. My sister, and I have permission to share this, she used the apple diet. She had an apple before every meal. She lost 20 pounds just doing the apple diet. And the apple diet isn't pure apples. It's just an apple before every meal. You eat whatever you want to eat, but just eat an apple before that. Dr. Art Uleen did a very interesting study. He videoed people, saw how much they ate, and the rule is you have to eat till you're full, till you feel satisfied. Then there was 2 rules. Remember your mom always told you to chew your food 30 times, remember that? So he experimented that, and he said 30 seconds between each bite, and you have to use a teaspoon or a dessert fork instead of a dinner fork or a tablespoon. How many people can use chopsticks? Here, raise your hand. How many people cannot use chopsticks? Raise your hand. All y'all need to start using chopsticks. Because it will slow you down, right? You taste your food here, not here. But as an ER doc, how fast do you think I usually eat? I just wolf it in, right? Shovel it down. But that's not good for you. You don't absorb the food that way. You don't enjoy the food that way. So he had the people use smaller utensils, and they had to wait 30 seconds between each bite. He found they ate 50% of the calories they had before and were just as satisfied. Half their calories with the same satisfaction. Who knows who Dr. Atkins was? Dr. Atkins. Does anyone know how he died? I don't know, but his family sued the coroner and they said it was from a fall. He had a CVA. But they actually sued to make sure that that was changed on the cause of death. But here's the thing. Do you know where Dr. Atkins got his idea? It's called the thermic effect of food. The thermic effect of food is important because the easiest thing to put fat on your body is, what do you think? Carbs, protein, or fat? Fat. It's actually fat, ironically enough, because the thermic effect of food for fat, if you overeat 100 calories of fat, that would be like putting an extra pat of butter on your toast. That's 100 calories of fat. Now that 100 calories, the body's going to steal 4 of the calories to process it. Notice I said process and not process, right? Process, I'm learning, right? Is that it will take 4 calories and it will turn it into the spare tire, right? What is 100 calories of carbs? I kind of told you, right? An apple, a banana, a slice of toast, right? That's 100 extra calories of carbs. So it is easy to take an extra slice of toast? Well, it's easy, but not as easy as just putting an extra pat of butter. That's like pouring the oil into the pan, like that was 1 tablespoon. Oh, that's 2 tablespoons, just a little extra time, right? It's easy to have more fat. Now, with carbs, the body has to take 19 of those calories and burn them in processing to turn it into fat. Now, what's an extra 100 calories of protein? What do you think? What does that look like? Like maybe an ounce piece of meat or fish or whatever, maybe half a cup of beans or something like that, right? That is an extra 100 calories of protein. Now, for the body to turn protein into fat is almost impossible. It has to take 31 of those calories and turn them away from that to turn it into fat. So which do you think he wanted people to eat more of? Protein, right? Because it's hard to turn into fat. That's the thermic effect of food. So if you eat mostly protein and carbohydrates, it's going to be hard to get fat, right? Very hard to get fat. The final thing is I'll tell you, does anyone know what a sumo wrestler is? Where are they from? Now, are people in Japan generally obese or are they thin? They're generally thin. So these guys are having to go against their genetics. Do you realize that? And here is the secret of the sumo. For breakfast, the sumo eats nothing. Then they have a lunch, and then after lunch, they sleep. Do you know when they eat their biggest meal? Late at night. And people in Japan go to McDonald's, sometimes not to eat, but to watch the sumo wrestlers eat. Because they put down burger after fries, after chicken McNuggets, and then they go to sleep. Ladies and gentlemen, we are the sumo nation. I just finished a camp meeting in Oregon last Sabbath with my wife, and 3 people, what did they commit to doing, babe? Losing weight. How are they going to do it? 2 meals a day. This guy was in construction. He did hard physical labor every day. He didn't eat breakfast or lunch. He only ate supper. And I'm just like, wow, that's incredible. So they committed to eating breakfast, and there's an actual report when Ellen White herself learned the health message. She was overweight. She needed to lose weight. She ate her meals at 7 a.m. and 1 p.m., not much exercise, not much huge change in her diet, but she lost 25 pounds in 8 months. About 25 pounds. But if you want to look it up, say 25 pounds of flesh. If you type that in, you'll see her little program there. And I have permission to use this. This is a program. Does anyone know who Stan Smith is? Stan Smith, good friend of mine. You know what he does before breakfast? He runs. But he runs like 10K, like a serious run, you know? And he eats breakfast at 6 and lunch at 12 and no supper. And he's in good shape. I'd say he's in great shape. For a man his age, I'd say he's in better shape than 99.9% of men his age, for sure. But he is taking advantage of what we call fasting cardio. Now, what's interesting though, is what do you think is going to be better? By the way, if you do fasting cardio, you lose 90% more fat than if you run at any other time during the day. That's how it works, 90% more fat. That's almost double bang for your buck, yes. However, if you take 45 minutes of cardio or 15 minutes after every meal, what is going to manage blood sugar better? Did you know that if you just take a short walk after every meal, it controls your blood sugar better than more time if you walked like at any other given time? And who said take a short walk after every meal? Auntie Ellen, yes. And now that's proven in the medical literature. I tell people never bet against the prophet because you will lose every time, even if it seems abnormal. So those are secrets to losing weight. But I want you to know that we can make a difference not just as diabetics, but we can learn the lesson from the lady on the plane. We can learn to give rather than to take care of just of ourselves. And I'm going to ask you this question as an appeal. Does anyone in your life perhaps not know the Lord like they should and does not have a saving relationship? Do you know anyone, family, friends, co-workers? Would you like to ask God, Lord, help me to win that person to you? I'm going to share a song that one of my teachers in missions, Pastor Bob Hancock, who's still alive, he worked in the Indonesian field for many years, but he taught us a song called Lay Some Soul Upon My Heart, and I'm going to teach it with you. I'll sing it first, you can join with me afterwards. Lord, lay some soul upon my heart, and love that soul through me, and may I humbly do thy part to win that soul to thee. How many people would like to make that commitment to God? Lord, let me win one soul to you this year. Just one. That's all I'm asking. If that's your commitment, stand with me as we sing and close. Lord, lay some soul upon my heart, and love that soul through me, and may I humbly do my part to win that soul to thee. Let's pray. Loving Father in heaven, thank you so much for that young woman that I was able to help on that plane. I pray, Lord, you would not only cure her of the diabetes of the body, but of the soul, that she would not be concerned about being increased with goods and her agenda, but be willing to listen, be willing to give, be willing to be humble and to learn. And I pray you'd help each one of us, Father, to not only overcome our diabetes, but to help someone else to overcome their disease of the soul, Lord, through Jesus Christ, our Savior. Help us to be as wise as serpents, but harmless as doves, to pray for that soul, to win that soul to thee, so that when we come, Lord, there will be a rich harvest at your feet. We ask in Jesus' name, amen.